Means it's time to talk to Dr. K, Dr. Kevin Kavanagh, retired physician, also the founder and president of a national organization called Health Watch USA. Dr. K, good morning.
Good morning, sir.
How are you today?
Very good. Bright and chipper Monday morning.
Positivity rate fell below 8 in Kentucky.
Yes, that is good news. Our cases are down 40%. Positivity rate is down a third. And I would suspect that we will soon be seeing the death rates also falling. So that is very good news.
On the other hand, Super Bowl fallout, I guess we will know in the next few days what, if any, problems that we had as a result of that.
Well, yes, and that's very scary because that's taking place at a time when we have these mutants or mutations which have come on our shores. And if those start to spread and take hold, especially the Brazilian and the South African variant, we could be in for another large surge with increased deaths. So we need to follow public health advice. There's no question about that. And some individuals are stating we should be upgrading your mask, making sure that your mask is multiple layers, has tight fit around your face so air's not leaking around the sides. And if you can, try to get a surgical mask or an N95 mask. And if it's an N95 mask you're looking for, make sure it has on an OSHA or NIOSH approval number, because there's now some of the masks which are labeled as N95s, but they haven't gone through as rigorous a process as what they should have.
What else do we need to know about this morning?
Well, the main thing, and this is kind of to me very disturbing, is that healthcare workers, including those at nursing homes, are not flocking to getting the vaccine, that up to a third of workers nationally are reluctant to get the vaccine. And in Kentucky, in the nursing homes, we read a report that the number was around 50%. And this is something that is kind of disturbing. You would want to have the workers to get this because it does place the patients and residents at risk. But it's something at this point you really can't mandate simply because it is a vaccine which has been authorized but really hasn't been approved by the FDA. In other words, it's gone through an emergency use authorization. It has not been totally approved. And so it's still up to the worker whether or not they could get that. But I do encourage healthcare workers, not only for their safety, but for the safety of their patients and residents, to get the vaccine.
Also learned this morning that Pfizer is picking up production. Have you heard?
Well, I have, and I think that's a good thing. The Pfizer Moderna vaccines appear to give excellent protection against the UK, which is United Kingdom variant of the virus. That's doubling every 10 days in our country and is expected to be the dominant strain sometime next month. These vaccines have been shown to provide at least some protection against severe disease from the South African and Brazilian strains, which have also been detected within our country. So this is something we want to see happen. There have been some other news regarding vaccines. Some of it has been, I think, overplayed in the literature by the Oxford AstraZeneca vaccine production being halted or paused because it's not effective against a South African strain. Well, that's really not what the study showed. It showed that it didn't prevent mild or moderate disease. Severe disease just wasn't studied, and that's in line with the other vaccines, is that it's preventing severe disease, people from dying, but mild to moderate disease, they do not prevent that. And one of the things that I think is also on a positive note is that what we discussed last week has been parroted now within the news media, that all of these three strains of viruses, which appear to have some evasion of the vaccines, they all have a similar mutation, and thus a single booster may well take care of all of these aberrant strains. And on top of that, because all of these mutations arose separately and they're all the same, this may be the last really major mutation we're seeing out of this virus. And after we get a booster out sometime in the fall, I think we'll be seeing this pandemic in our rearview mirror. At least that's what I'm hoping. So Until then, let's follow public health advice and save lives.
Sounds good to me. Now, you'll be off on Wednesday, but we'll talk to you again on Friday.
All right. Thank you very much, Jack.
Yeah, thank you. Dr. Kevin Kavanagh, founder of Health Watch USA.